Good morning. I'm your nurse today, Ashley. I just wanted to go over medication that was prescribed for you. So the medication you've been prescribed today is Levophed, also known as norepinephrine bitartrate. Sorry, that's kind of a mouthful. That's why we call it Levophed. So it is a vasopressor, which means that it works to constrict your blood vessels. It does this by stimulating the alpha and beta 1 receptors in your sympathetic nervous system, which is your fight or flight system, not your rest and digest system. This causes constriction in your blood vessels and it stimulates your heart. Have you ever had this medication before? If you have you ever had an allergic reaction or extreme adverse effects? When we get started, we're going to ask you your name, birthday, and if you have any allergies again, just to make sure we have the right medication, the right dose, and the right patient. So things might get a little redundant, but we just want to make sure it's right. This medication is going to work to help raise your blood pressure. The medication is not a medication that you would use at home. It's strictly for here while we're in the hospital. We would make sure that we're monitoring you closely to ensure that it's working and it's not causing any adverse effects. We have tried to raise your blood pressure by giving you fluids, but it isn't helping as much as we would like. So we're going to go ahead and start this medication. This medication is going to run through your IV. You have a central venous catheter, but we could also use another vein if you didn't have a central line, as long as it was a large vein. As I mentioned, we're going to monitor you and your blood pressure as we're giving you this medication because we might need to change the dose as we go. That is called titration. We're going to start this medication a little on the high side to get it working, and then we will lower it to maintain the correct blood pressure. The first dose is going to be 8 mcgs a minute, and then we should be able to lower it between 2 and 4 mcgs a minute to maintain your systolic blood pressure between 80 and 100. While you're taking this medication, we'll be monitoring your blood pressure every 2 minutes until it has stabilized, and then after that, we will be checking your blood pressure every 5 minutes. Either way, we will make sure that someone is here monitoring you the entire time and you are never left unattended. Some adverse effects you might experience are going to be headache, anxiety, bradycardia, which is where you have a lower than normal heart rate per minute, severe hypertension, which is high blood pressure, and that occurs if the medication dose is too high. You can also experience arrhythmias, which is going to be changes in your heart. You can also experience some respiratory difficulties and anaphylaxis, which is also known as an allergic reaction. If that occurs, we'll stop the medication immediately and notify your provider for the next steps. This medication could also cause extravasation, which is where the medication leaks out of your veins near your IV and spills into the surrounding tissues. This could cause irritation or necrosis, also known as tissue death or gangrene. Again, we'll be right here monitoring you, so I don't want you to worry about that. We're also going to keep atropine on hand in case you experience reflux bradycardia. And again, that's where your heartbeat is too slow, below normal levels of 60 beats per minute. We also have phentylamine on hand in case we need to decrease the vasopressor effects, and propanol in case you develop any arrhythmias. We have you hooked up to the heart monitor, but I need you to notify me if you start feeling any heart palpitations, like your heart is beating different, or if it feels like it's skipping a beat. Those could be the arrhythmias. I will also make sure to monitor your IV site for any extravasation. If I could speak, that'd be good. But I need you to let me know if you start experiencing any pain at the site. Remember, you might feel a little bit of irritation, but we need to know if the pain worsens or if it's extreme, because that could be the medication leaking into the tissues like we discussed already. I know you have an indwelling catheter in place, so we will be monitoring your urine output, and if it starts to decrease, we will make sure to notify the provider immediately. If you notice any of the other adverse effects we've mentioned, please make sure to notify me immediately. When the provider decides you no longer need this medication, we're going to make sure we taper it and stop the medication slowly so you don't experience any adverse effects from stopping the medication too quickly. Do you have any questions for me?